Good evening, everyone. It's a pleasure to have you here for this webinar, and we are delighted to have you join us this night as we explore this impactful and rewarding role in the healthcare industry. Now, this webinar, the idea behind it came from the fact that we've been running a lot of trainings, at least myself, as part of Clever FX Technologies, and also a couple of other colleagues as well, and the Esther Organiro Caregiving and Physiotherapy Center. We've been running a lot of healthcare trainings over the years, and there have been a lot of questions. A lot of people have been asking different things. There's a lot of knowledge out there, but that knowledge is not verified. Usually it comes from sources that may not truly know what the industry is all about. So you find a lot of people making wrong decisions concerning their strategy in learning about healthcare, and also in terms of traveling abroad, in terms of getting a job abroad, in terms of actually making a life for yourself, whether here or outside the shores of this country. And because of that, there have been a lot of horror stories. We've had a lot of cases of people who have been promised so much and they travel out and they are now left stranded. We have horror stories too of people who have traveled abroad because their papers were not complete, or they did not follow a certain procedure, or they were just ignorant about a lot of things. They were deported back. So we don't want a situation whereby you are starting this year, 2025, without being informed correctly, without knowing the right steps to actually take and the right path to actually follow. Now, there are a lot of opportunities in healthcare, whether home or abroad, and it is important to have the right strategy, to have the right mindset, to know what exactly working in healthcare entails. Now, I know some of you here are already working in healthcare, while some of you are actually new to the world of healthcare. So we have the opportunity to actually speak to a diverse set of people. So some of you are here because you're already in healthcare and you just want to know, okay, which country can I travel to? What opportunities are available? What sort of visa should I be getting? What sort of roles should I be hunting by virtue of the certifications I already have or the experience I already have? While some of you are new, and you want to actually just get started in the world of healthcare. So all these are questions, and this is an opportunity to be able to have those questions answered. Now, to that point, we have someone who will be coming in. We're just waiting for her to join, who runs a physiotherapy and caregiving center. And she has worked both home and abroad, and she currently trains certified nursing assistants. All right, so that's what she does, and she also does whole lot of things as well. She consults for universities, she consults for the federal government as well. So she's well versed in the world of healthcare. And then also, we are also going to, that will be tomorrow. We have also somebody who is a travel agent. He's based in the US as well, but he travels a lot. And he will also give you information concerning traveling, concerning opportunities that are also out there as well. And that will also be make up part of this training as well. So the focus, of course, is the certified nursing assistant program. When it comes to healthcare, of course, there are so many different roles in healthcare that you might decide to work in. You might decide to work in the mental healthcare space. You might decide to work in the public healthcare space. You might decide to work as a social worker. You might decide to work as a nursing assistant, which is what we are going to be talking about. All right. So, thank you once again for being here. I really appreciate your presence. Some of you have taken trainings with us in the past, and you're all highly appreciated. Some of you are new, and some of you are coming from different training providers. So I'll use this opportunity to appreciate Kuzang Global from Mrs. Dorcas. I appreciate you, and also Gamat as well. I know we have quite a number of people that are coming from Gamat, and we also appreciate you, ma'am. All right. So, please, once again, there are certain rules that everyone is expected to follow in order to enjoy this particular webinar. Please, please, please do not switch on your mic unnecessarily. There will be a segment for question and answers. This is just going to be a 1 hour program, and then you can ask all the questions you would like to ask. But please, during the time whereby the speaker is speaking, please do not switch on your mic. Avoid background noise. All right. One more thing, this session is being recorded. So if for any reason you are not able to join, don't worry, the recorded session will be posted in the paid participants group. All right. So once again, thank you so very much. I think Mrs. Esther has joined us, so she would introduce herself in detail, and then we can get to the topic proper. All right. So, Mrs. Esther, are you with us?
Yeah, good evening. I think I'm having issues with my phone, so I'm trying to connect with my laptop. So
Okay.
I don't know if you're hearing me.
Well, I can hear you loud
My
and clear.
laptop. Hello.
Okay.
My laptop
We
is
can hear you
having
loud
a
and clear.
fine.
Okay.
The camera is having issues, so I'm trying to connect to camera so they will also see my face.
All
So,
right.
but I'm connecting with my
That
I'm
would
still
be great.
connect with my phone, my iPhone. So, but whichever way, and try with this iPhone. Let's see. Good evening, everyone. I'm still trying my best to see how we can see my face.
Okay.
My name is Nasaganiro Obona. I'm actually from Delta State. I was born and bred up in River State. About 46 years old, a professional healthcare worker. I was once also a satisfied nursing assistant, a caregiver. Everything that has to do with it, I run around to make sure I acquire it. And presently, I'm the CEO of Esther Oganiro Foundation and Physio and Care Service Center, White Dove Healthcare Project. By the grace of God, it's my pleasure meeting every one of you. God bless you all. And I also would like to also know the people I'm also discussing with or having this program with this evening, if you don't mind.
Mm, okay. No, we have quite a number of people here with us. I don't know if we'll be able to take individual introduction. Um, I don't know if that will be possible, so that we don't
If it's not possible, we
make the
can
class.
actually start off with what we have to do because we just have an hour to do this. If you don't mind,
All right.
can we continue, Mr.
Yes,
Korode?
ma. Yes, ma. We can continue, ma. Let's just go on.
Yes. Yes, we
Okay,
can
fine.
continue.
Let's see. Okay, fine. I think I'm still having issues with the camera and all that. When we connect, I will let you know. So we're going to start with nursing assistant, a satisfied nursing assistant. When we talk about satisfied nursing assistant, first of all, we're going to talk about the art of caring. Art of caring. When we talk about art of caring, we mean being a nursing assistant. Then also working in the healthcare system, understanding the legal ethics aspect of healthcare, also understanding the people in your care, and also how to communicate with them. So we should be able to talk about this in the area of nursing assistant this evening. Okay, fine. You know. So now, when we talk about nursing assistant, being a nurse assistant, CNA, being a nurse assistant, we're going to talk the goals of being a nurse assistant. One, if you have your barrels and paper, you can take the opportunity to put down one or two things down, okay? So, well, one, we're going to talk about describing what a nurse assistant is, responsibilities and requirements that a person must meet in order to work as a nurse assistant. If you want me to come back, you let me, I'll come back, okay? Then, secondly, describe how the nursing assistant. Let me. Sorry. Don't cut. Okay, better. I think we're seeing. You guys are seeing me now.
Okay. Yes, we can.
That is me. Okay. So now, that is too loud. So when we're talking about that, so we talk about to describe how nursing assistant it echoes. It's not like the way it used to be. Remove this. Okay, this. This. Why is this? You can see me now. Can everyone see me?
No, we can't see you.
What is the way I talk with this? Let them just see me when I see myself.
Okay, all right, that's fine. Okay, it's
Okay, you can all see me. Can everyone see me now? This is me. Sorry, you know the network system here in Nigeria, the way it is.
okay.
Okay, fine. So let's continue with what we're doing. You now see my face. If you see me on the street, you'll be able to recognize me and all that. So thank you. I think I'm good with this, the laptop alone. Yeah, thank you. So we're going to also continue to, like I said, the third one, we're going to talk about on how to describe the tasks that are usually outside the nursing assistant scopes of practice. That is number 3. Then number 4, to explain how to focus on the person who is receiving care and how can you lead a better care. Is the network steady? Are we communicating?
Yes, can hear you loud and clear.
Okay, thank you. Then the list of 5 principles of care and also to explain why each is important. Then the last but not the least here, when we're talking about the goals, then we'll talk about how to explain that, what it means to be a professional, describe on how a nursing assistant can display professionalism on the work. Are we on the same page?
Yes, ma'am.
Okay, fine now. So now when we talk about who is a nurse assistant, nursing assistant, a nurse assistant, who is a nursing assistant? A nurse assistant is someone who works under the supervision of a licensed nurse. Someone works under the supervision of a licensed nurse. That is to say, a registered nurse like me or a licensed practical nurse, the LPN. Do you get it? To provide basic care for people who are ill or who are sick, okay? Injured or disabled. Do you get it?
Go on.
Okay, a nursing assistant can also care for those who are sick, or for themselves too. They can also care for themselves. Also meeting a personal, physical, and emotional needs of a patient. Not just caring for a patient, not just treating a patient, but must take instruction from an RM nurse and also give out an emotional needs. For example, children from the area where I work, especially these children with special needs or these people living with disabilities, the best you could do for them is to help them with their emotional needs. It helps with their healing process. Not just only treating them, but helping them with their emotional needs. it goes a very long way for them. So that for those of you who are aspiring to become a nurse assistant, you should always have in mind, aside the training, aside the scope of work that you're going to do, you have to learn how to help them with the promotion of their emotional needs. For example, a child with special needs that drops salivas, and some of you are being irritated with saliva, how do you help that child? When the child notices that, oh, this person will, because you see the problem that we don't understand about this certain set of people is, in as much as they are deformed one way or the other, God Almighty gave them good intelligence that their brain works for them, their brain speaks for them. The way you handle them, the way you pamper them, that is when the way they go after you. And that is where how the healing process comes for them. If they are free with you, they are happy being with you as their nurse assistant who is taking care of them, you see them, their healing process go faster. So that is one secret that people do not know about taking care of these people. And if you are not the kind of person who have good relationship with people of these certain categories of people, aged people, those people who are bedridden, those people who have stayed in a long time, we're going to come to that later. Let me not deviate from there. You cannot do well as a nursing assistant. I know majority of people want to be a nurse assistant to travel outside the country, but we ask the question, do you have the passion for it? Do you have the passion for it? What is that? Huh? I'm busy. I can see that I'm doing an international stuff. Sorry, we're in the facility, so a lot of distraction, please. Don't call me again till after 1 hour, please. So we're going to discuss about the key terms or major key terms of what a nursing assistant, what they should be able to do, and what you're going to do in the healthcare section. Do not go to, if you're traveling abroad because you learned that there is so much money in nursing, you do not have passion for it, you do not have flair for it, you are not willing to cater for those children with special needs, you're not willing to cater for those people living with disability, you're not willing to cater for the aged people who has no hope, you should look for another career. Don't go for the money. Are we on good page?
Go on, ma'am.
Are we hearing each other?
Yes.
Okay, fine. So let's talk about the key. Okay, let's talk about the key terms of a nursing assistant. One, you're going to talk about the nursing team. Nursing team. As a nurse assistant, you must work as a team member. Nobody knows it all. What A knows, you should use it to work with B. And when you're doing that, you do it with respect. Don't do it because you feel, even with my students here, I try aside the training, I try to coordinate them that for you to work well, work professionally as a nurse assistant, you must work as a team member. If you don't work as a team member, you're not working professionally. Then two, please, you can put this down into writing. Then two, the ADLS. What is ADLS? Activities of daily living. ADLS, activities of daily living, you must put it, is one of the key terms of a nursing assistant. Then the healthcare team, then scopes of practice, empathy, compassion, and delegation. These are the key terms of what you should be expecting as a nursing assistant, okay? Then we're going to also talk about a nursing assistant, responsibilities of nursing assistant. What are the responsibilities of this nursing assistant? There are key terms I just mentioned for you. The key terms of responsibilities of a nursing assistant. So put it in writing. So today will be meaningful and why for us. spending this 1 hour. Okay. What are these? Let me expand a little bit on what a daily activities of daily living is all about. Activities of daily living. Let's quickly talk much. Activities of daily living, your duties and responsibility is such as eating, bathing, dressing, grooming, using the toilets, and helping the patient to move. How do you groom a patient who is bedridden? Maybe probably the patient has been in a long-time system, bedridden, and the patient can no longer walk. You're going to help the patient to groom the person how to make use of the walking stick. You're going to groom the person on how to start using cutleries again. Groom the person on how to change their wares to help themselves. It also helps with development, helping the patient to develop. It's not like you're going to do all the job. While you're doing the job, you're also going to help the patient, by grooming the patient, telling the patient to hold this. We also do that in the facility when we're training, we're having a patient, maybe a stroke patient. After a period of time of doing that for the stroke patient, treating the stroke patient, we'll start letting the patient to start touching his or her hands, using the hand to eat or do one or two things. Do you understand? So these are the things you do as grooming your patients. Okay? So when we talk about, you also help the patient by eating, bathing, dressing up the patient until the patient is able to now do such things by themselves. Okay? All these are the routine responsibility that a nurse assistant must obtain. You don't work as a lazy person. You also help for measurements of height, the weight, your vital signs. You also help. Also help with safe environment. Make sure the patient is in a safe environment and a clean environment. If you have chosen to be a nurse, a nursing assistant, to pursue your career as a nurse, you must learn how to be neat. Okay? Neatness should be your key word. Do you understand? Hello?
Go on. Yes, ma'am.
Okay. Then when we're talking about the duties of a nurse assistant, you can use your biro, pick up quickly. Let's do this is a professional talk, so I will not be slow. So you quickly grab when I'm talking. So number one, you're going to talk about reports to work as scheduled on time. Coming to work on time is very important. Then number two, attend to your shift report. Organize your assessment and make round and on your residents. Then number three, deliver person's care emotionally, like I said earlier on. Support them emotionally to those under your care. You must support them emotionally. Do not neglect them. Don't gossip about them. It is not right. Then number four, regard all the residents you have under your care. You must regard them. And you must also assist them when they need assistance. Okay? And supervise them. Answer to all their requests. It is very important. When they call you 100 times, you must answer them. The difference between professionalism and common people, sometimes you call some of the workers here in Nigeria here, when you call them, if you don't send them a message 2-3 times, they are getting tired and they're expecting to go home with 4 million naira. How possible? But when you work as a professional, when you're charging people, you're charging them with your chest, strong chest, because you know what you want to deliver to them. Do you understand me? So, and you must also provide care. Provide care according to what the resident needs. You plan their daily manners of feeding, protect those your residents, and their privacy and dignity goes a long way. Do not say because you're sick, you treat them anyhow you want. It is wrong. You must treat them with respect, and their privacy and dignity is very important. Maybe if we don't get to the level of ethnic principles, maybe tomorrow we'll talk more on that ethnic principles, so that you now know that there are laws that govern these things. Or maybe when you come to class, those of you who want to join us, you know that there are laws that govern these principles. It's not like in Nigeria that we are lawless. If you're going to work outside the country as a professional nursing assistant, you must work professionally. You must keep to all these laws. You must work and build and maintain relationship with them, good relationship with them and their family members. Hello, Mr. K.
Yes, ma'am.
Are you listening? Are you guys with me?
I can still, yeah, we're still with you.
Okay, fine. So you must work, build a strong, good relationship with these residents and also with the family members. You keep them warm, positive, and be supportive to them. You must also report every job you do. You must report to your supervisor. And what are the supervisors like I mentioned? I said your RM nurse or the LPN nurse. Don't forget. Okay? You must, every task you carry out, you must get the tax from them and at the same time also report the tax that you have done to these nurses, to your supervisors. Then they will be the ones to observe. Okay? Then in everything you're doing, you must come on time. Don't play with time. Time is money. Professionals don't tell stories about time. You make sure you book your time, you check your timetables. Don't come to work. You're supposed to work by 7. You're coming to work by 8:30. Instead of you coming late, come earlier. It is better they know you as a punctual person than for them to know you as a late comer. It is unprofessional. Okay? Then you must do documentation. In every care you take for your residents, you must do an accurate documentation. Do not be lazy. Don't call nurse A. Oh, nurse A, I'm running late today. What was your vital sign yesterday? Do not record the vital sign of yesterday for today because of laziness. Because the vital sign you recorded today can cost a life if you record the wrong vital sign. Do you understand? So I can't give all the details so that I'll be able to meet up with time. I can do short with the little I've given to you, on duty assistant. Then the job requirements. Let's talk about the job requirements of the nursing assistant. What are these job requirements of the nursing assistant? One, for you to be a nursing assistant, you must have a valid nursing assistant certificate in a good standing with the state. For example, the one we're running here in Nigeria now, we're combining with our partners outside the country to affiliate with them so that those of you who are traveling outside the country, as they do the scanning code, it returns back to us, return back with the people we are affiliating with, not just to make noise and they collect people's money.
Oh,
And some people were, okay, back again. Hello?
okay.
Network.
We can hear you. Yeah.
Yeah, yes, ma. With you, ma.
Network. So we should be managing the network. So you must have a solid, complete, trained, satisfied certificate for you. You don't just wake up and join the team. You don't be a Nigerian auxiliary nurse and you want to travel out to work as a nursing assistant. It's different. The curriculum is different. The training is different. Some RN nurses still come back who are traveling outside the country to get that our certified nursing assistant certificate. So the training is very vital. Then secondly, you must have the current CPR certificate, health and safety certificate, you must have it. It serves as your license as a certified nursing assistant, you must have it. Then thirdly, you must pass a criminal background checkup. You must. All these are the things, requirements, the job requirements of a nursing assistant. Then fourthly, you must complete a health screening. One, of tuberculosis. You have to do health screening of tuberculosis within 2 weeks of hire. You must do it. So if you are aspiring to be a nursing assistant and you're having some certain health issues, please go and treat yourself. Because our own part, we're going to do our part for you. Make sure that everything we're doing for you is professional, no excuses. So do not use your hand to spoil your game for yourself. So you must check yourself, screen yourself before you go there. Don't go and disgrace yourself. Go and do the assessment for yourself, get the result, and start treating yourself of whatever illness it is. Because even flu, common flu, they will tell you to go home. How much more having tuberculosis? Hello?
Yes, ma'am. We're with you.
Yeah. Then you see the word, we are using must. We're not saying you can. Maybe the word is must. So it is mandatory that you must pass a drug screening within the test of within 90 days. So those of you who are drug addicts, those of you who are taking illicit drug, so you have to drop within 4 months to when you want to travel because they must screen you. Bribe, you know, this one, a Western country. It's not Nigeria where you will give tips and they will put negative for you when you are being found positive. And when they find you positive, they will arrest you and join on top. You go to jail for a while before they deport you. So you now say that those people scammed you after training you. So keep to these laws so that your certificate will be useful to you. You get it?
We're with you.
Yeah. You must also be able to lift, push, pull up at least to 30 pounds. It is not a job for lazy people. Those of you who are seeing my picture now, you can see me say, my body don't be muscle, why I take the work. So the job is not a job for lazy people. Healthcare job is not a job for lazy people.
Nigeria.
You get it? Healthcare job is not a job for lazy people. Sometimes I stand, if you see the way I'm looking now, I've been standing for the past 1 week. I can't wait for tomorrow to come. After church, let me off my phone, stretch, and sleep for good hours before I come to join you guys in the evening. So the job is not for lazy people, okay? And you must also have a basic computer knowledge skill. So if you don't have a basic computer knowledge skill, why? Because some of your documentation on your system, it's not like Nigerians who do not know the value of spending money on paying workers. Do you get it? If you think they're going to pay an IT guy, especially to come and document the vital signs, you will do the documentation yourself. You will do the paper write-up, you will do the system documentation. So if you're not a computer literate, please go and learn how to do basic computer jobs. The PowerPoint presentation, Excel and all those stuff. So I can be able to do recording of documentation of your patients. Okay? It is a must. They will ask you. And you must have a good communication skills and ability to interact with people, no matter who is sitting in your front. You don't interact with people, you must interact with people with respect. No matter who is in your front, no matter the millions you have in your account, no matter the mansion you must have built, you just decided that, oh, I won't just come this country, I just come make some cool money. I'll be big boy for Nigeria. I'll be big girl. Nobody they ask you that question. Keep the big boy and the big boy in your house. Respect people. Talk to people in good manners. Because communication skill goes a long way as a healthcare worker, a nursing assistant. For you to move further to the next level, communication skills is very important. And the manner at which you communicate with people, two different ways of communicating with people. Some people might come and say, oh, Let me whisper to her. Maybe say after now they will say I shout for her. And when you come to whisper to the person, you say, Madam, if you like, wake up on time, make a bath. If you don't like, now you serve. If you want, die. You are whispering. Is it not better you even shout? It is even better you shout than to tell a patient that. So when you tell a patient that, you're scaring the patient wouldn't want to. And remember, our skin is not like their skin. When they say African, they know Africa. They love to employ Africans because we are hardworking. We have the energy to work. But they don't like us. So for you to grow in the system, you must be polite in talking to people. You must show respect. You must be humble. When you come back, your papa na oba, you can spend your remaining money in your father's palace. But when you are out there, we are talking about life now, dealing with people who are bedridden, people who are sick one way or the other. So you must operate with them with respect, communicate with your family members. There are multi-billionaires you meet as a patient. Your communication skills might fetch you millions on the table. Some of them die and put your name on the will. Your interaction, your communication, your care brings that on the table for you. Okay? Then also not just the patient, even their family members. You should also talk with them with respect. Not be the one where you go see their family members. You go say, Madam, leave this room. No, I want to do assessment. You don't use that word. You talk as a professional. Please, mom, if you don't mind, you'll be back in the next 10 minutes. Let me carry out an assessment in a very polite manner. And wear a smile on your face when you're doing that. No carry stone face, travel abroad, go work as healthcare work. You know, say Nigeria will not too fine. Our black face join. You can't carry stone face on travel. You need a walk. You get it? It doesn't work. You must always learn how to wear smiles. Imagine me, I've been working for 1 week. But you see me, I still trying my best to wear smiles while we are communicating because I'm used to doing that. Do you get that? Then we also, this one's, I'm trying to give you all the details because it's a must that you must have it. You must, there are responsibilities that you must. They must also be, you must able to be a multitask person and fast in your space. It's not for lazy people. Because, for example, Mr. K, I don't know if you've told your people about medical outreaches we do for students, you know, where you find like 100 people standing in front of you. You'll be the one to carry out their vital sign. And the vital sign we are going to do, you use your thermometer and your this thing. You use your stethoscope and siphonometer to do that. Only you want to attend to 100 people within range of 15, 20, 30 minutes. And maybe that time, if I'm your supervisor that time, you see that you're working with a soldier woman. And I'll call you, Mr. K, how many minutes? How many patients have you worked on? So it's not a job for lazy people. Maybe at the same time when you're carrying out the vital sign, you're doing the documentation. That is the multi-task. You get it? Yes. The multitasking, you must carry out. Okay? And in a fast pace, it must be in a fast pace working environment. Not call anybody to come and help you. When they give you that task, this is what you're doing. You're going to do documentation and carry out vital signs. Do not call her, Nurse Becky, where are you? Do it. Nurse Becky has her own job to do. Do you get it? And they have time. There is time, not African time. There is nothing like after. If not for my network that has been interrupting, I've already, Mr. K knows I started waiting since 15 minutes ago. I told him I'm here waiting, but my network was fumbling. So you must keep to time, okay? You must also have the ability to understand and follow policies and procedures. There are policies, there are procedures. Do you get it? There are policies, there are procedures. So let us use our few minutes. Let's also recap on so many things. He said, a person who wants to become a nursing assistant, do you understand? You must do your course. You see your course, you must do your course. And it must, like I said earlier, it must be according to the federal government, this thing specifies minimum of 75 hours. So, like we are running here now, if FCDA, National Health Insurance, did not give us go ahead, we cannot run it. Ministry of Health, they don't give us go ahead, we cannot run it. Because when you travel out there, they have to connect our certificates to them, and our tariff that we have with them, they will connect this. Oh, so people in Guarimpa, or so people in Najabi, or so people in so place. Do you understand? So we know them. They are paying their tax and all that. So the same thing are applicable to you. So everything the federal government or the state, wherever country you're going to work, the rules and regulations you must keep. Then another thing, you must be in a classroom. So it must be in a classroom to do your practical and do your training. Do you get it? But in the lab, you must do it. They want you to see the video of where in the classroom with group of students, other nurses who are training like you. They give those people job first than every other person. If you train online, there's chances for you to get a job. But they give like 10,000 people who are trained in a facility, in a classroom, when there is documentation and everything, there is practical and everything, to avoid quackery. So they prefer to give them job first before they consider those who just did fully online. So these are their requirements. Then the clinical setting, that clinical setting, the opportunity for you to be in a setting where somebody has to supervise you, direct you on how you're going to work on a patient, how you're going to handle a patient, what and what to give to a patient. When a patient is in, you don't talk. You don't leave your phone on. You don't make noise. You don't disturb your phone. Or you're attending to a patient. You want to give what do they call it now? Blood sugar monitoring now. You have punctured. The blood is dropping. You're picking your phone and you're holding the patient, and the blood is dripping. It's against professionalism. It's against professionalism. So there are laws, there are procedures that governs this thing that even the government has approved it. If you cannot keep to those laws, you don't work as a healthcare worker, generally. Okay? You don't work as a healthcare worker. So when you work as a team member, it also goes a very long way. So, but we'll still be wrapping up for the day so that you can be able to ask your questions. So the final one I'm going to talk about, we're going to talk about for today, we're going to talk about the chain that connects the nursing assistant, the patient, and every other people that has to do with the healthcare section. So when we talk about, you can use your biro too to put this down. So we're going to talk about a patient receiving care. The patient who is receiving the care. So under the patient who is receiving the care, you now have the strengths of the people who are around this patient receiving this care. One, the first important thing is the family member of this patient receiving this care. I want you to understand that as a nursing assistant, that you must need a dietitian. You must also need a physiotherapist. You must also need a doctor, an advanced doctor. You must also need an RM nurse. You must also need you as a nurse assistant. Then the last but not the least, you must need a discharge planner. These are the chain that surrounds the patient, the residents. These are the chain that surrounds them. Okay? Jesus, I have a crazy good afternoon inside. You know, you must have this chain that surrounds these people for you to work effectively as a nursing assistant. So with this chain that you have, this chain of people that you have, they are the people that will support you to work professionally as a nursing assistant. You guys are going to work as a team member. Today you register as a healthcare worker. Even if it's just one day, you become equal and a team member with even a doctor that will instruct you on what to do, and a nurse. Everybody becomes one and become a team. I think I call it off for today. And we'll continue to talk maybe tomorrow. Thank you. If there's question, we'll quickly ask. I'm still in the
No, that's
facility.
someone, Ma. Thank you very much. Thank you so much for that expository session. We'll be
You're welcome.
leaving the floor now for questions. If there's anyone that have questions, please ask your questions intending those that are having the intention of taking the settlement course or want to travel abroad for this particular job opportunity and all that. Please ask questions. Don't ask people that don't know and that will not give you the right information. This is the right time to ask all your questions and all the challenges and all your fears. Please ask your questions now so that you can be attended to. Thank you. So please, if you have any question, just put
Question.
up your hand. We'll pick you up. We'll pick you from there.
Hello.
Yeah, we have Asebe. Asebe, please unmute yourself.
Okay, thank you very much for this expository lecture. I'm so grateful. Thank you, Ma. My question is, in this very training, are we going to learn how to check vital signs? In this training, are we also going to get a first aid certificate? Are we also going to get a basic life support certificate? These are my questions. Thank you, Ma.
You're welcome. All the certificates that we mentioned, you're getting it because it's part of the requirement. For we are partnering with the American, is their curriculum we're using, the Western curriculum and the American health and safety, ASHISH, health and safety, and sir? Yes. That is why we're training this one. So then at the same time, the Red Cross Society, American Red Cross Society, we're also partnering with them to give you a quality this is. So the training is purely for those who are actually who really want to travel outside the country on a professional training. It's not for those, it's not for loafers, it's not for those who want shortcuts of healthcare section. So when we do this training, all this training, there are more you will get. Even the ACLS professional training and the certificate is available. So Mr. K and Mr. Docas, they're also in position to enlighten you better. Some of the stuff that I will not be able to stick there to answer.
Okay, thank you very much, Ma. I believe, Sebe, you've gotten clarity on that. So for CNA training, you are definitely going to get those trainings along. But in our groups, our admins will give us more details too on it. So let's go to the second person, Olaimi. Please unmute yourself and ask your question, then you mute yourself back. Thank you. Olaimi, we are trying to hear you.
Okay. Everybody.
Good evening. How are you?
Can you hear me now?
I can hear you.
Yeah. Okay, yes. Anyway, yeah, I'm a CNA. I'm very satisfied. I just finished my course actually. So my question right here now, why I really joined this webinar is one, I don't know if this webinar is going to give us an idea of how we're going to go through maybe if we want to travel to practice, like work with our certificates, then will there be someone that can help us with the CV? Maybe you have one that can help with the CV. Then I want to ask a question: is it compulsory? Is IELTS exams compulsory, or do we just have to get English proficiency or some proficiency? So that's just my three questions. Number one, the CV. Then number two, are they going to put us through? Then is IELTS compulsory? Thank you.
Okay, Madam Dapas, I didn't get that question. Maybe she should and will reply. I
Okay,
didn't get that.
yes, ma. She's asking, must she get this English proficiency test certificates before she can travel out for a caregiving job? So she has done a such that certificate, and then because talking
Depends on
if
the
Normally,
country she
there is
apply
any
applying
if
to.
someone wants to travel outside the
if there is
country. Whatever
yes, if there's
qualification
any form of
should
assistance on
be on a page.
CV
I don't want
construction,
the
how to construct
I'm an
activities
employee to
and
the
all that.
country where you're heading to. Hello? Not.
Okay, ma.
Hello? Hello?
Okay, could you repeat that, ma?
Yeah. Okay, 1 minute. 1 minute, Mr. K. Daddy, can come and answer them that question because you also have idea.
Yeah, so
Okay. I don't want to answer that particular question. My father, not least someone, my father.
okay, so hello, how
Looks like we're battling network here.
Okay.
Hello?
Can you unmute
yeah,
her?
You
can
are
you hear me now?
muted.
Okay, we
Okay,
can hear you
yes,
now.
You can hear me? Great,
yes.
great. So it's very fundamental. That ability to communicate wherever you are is fundamental. So that certification is a plus for you.
Exactly.
You need it. You need it. It adds to your value and your worth, what you're going to do and deliver. Do you understand? It's important. It's important. Very important.
So, madam, I've answered
Excuse me,
your question.
can I add something to the question, Olayemi?
Yeah, we are here.
Yeah,
We are here to help you. We are here to help you. Talk to us.
Yes, so you were asking if you need an IELTS to apply for a job. So IELTS depends on where you'll be working, which country you are applying to. If IELTS is required, most of the time is not really required, especially because Nigeria is an English speaking country. It's only required when that country does not recognize Nigeria as an English speaking country. For example, like I'm also studying as a resident nurse here in Germany, and I had to take the German language course because that was the requirement, because German is mostly spoken here in Germany. So it depends on the country you intend to work in. If it's an English speaking country, if it's a Dutch speaking country, if it's a French
Hello.
speaking country, if it's a Spanish speaking country. So it all depends on the country you're applying to. I hope that answers your question.
yes.
Thank you, Dr. Chama.
The network is really bad. Though.
The network is bad. Yes, please, ma,
It's
she asked another question.
it's epileptic. It's very erratic. Yeah, it's epileptic. We can still hear you. We can still hear you,
Okay.
and I think we can manage the network to achieve what we want to achieve. Is that okay?
Yeah.
Then I
So I think there is a
about
question that have not been touched that she asked about CV construction. Whether there's any way thoughts on how she should put in her CV for the application. Hello, hello.
Dr. Chama.
Choma is muted. So Choma, can you unmute and then talk to them?
And answer that question,
Answer that question.
please.
Can you unmute yourself?
Okay, so what was the question? What was the question?
Please, can you repeat again?
I think she talked about CV
Professional CV.
reconstruction.
Definitely.
How she can reconstruct her CV to align with purpose. I think that I'm
Yes,
not sure.
definitely, yes. Yes, it's deep. Like I said earlier, we need to, we when you take the nursing assistant course. I don't know what she intends on doing. If she intends in taking the nursing course, or if she already has a nursing certificate and she wants to just apply to a company. I'm sorry, to a hospital in the country she has chosen to move to or relocate to, then we obviously have to look at their requirements and then reconstruct her CV, you know. So that's not a problem. That's something that you have to do for the application of the job.
Thank you very much, ma'am, for that. Thank you. So let's go to the next person, Tosin. Tosin, please can you mute yourself and ask your question?
Just I need clarification, and I also need to be well informed. What's the difference between the CNA and the certified caregiver
Caregiver.
assistant? Yes, what's the difference between them, and how can each of them fit into each other? Something like that. That's just what I want to just know.
Okay.
Okay, let me quickly answer that. That was my father. I have a caring. I'm daddy's girl. So, so that is always out to support one another. My father just walked in and helped us doing this. Okay, so like I said, the difference between caregiver and the nursing assistant. One, let's use the word caregivers. That is why it's like a stage, a younger stage of a healthcare. The other word, we say caregiver, we see caregiver as a like professional ourselves. This is where I put it, professional ourselves. So that is why we decided that we'll give you the little training of a professional caregiver as your certificate. So that you would go there and start working for someone and someone is using you for 2 years just because you have a certificate of a caregiver. If you're working as a caregiver, you are those people they assign to people's house to clean, cook for them. A satisfied nursing assistant does not cook for anyone, nor do they do laundry for anyone. Do you get it? They do tasks being given them by their supervisor, their maybe doctor, an RM nurse, whoever that is in charge in the facility where they work. But the caregivers, they will tell you to come and clean house, wash plates, cook for this patient, and all that. That is the difference between a caregiver. And the curriculum of a caregiver is not as much as a certified nursing assistant. We go as far as of 100 training of nursing attached to the certified nursing assistant curriculum. That is the difference. So a caregiver does not also vital signs, does not also give medications. A caregiver, their job is limited, it's restricted to that level of like has professional house level. They make it refined to wear the uniform in. But when you are a satisfied nursing assistant, the tendency for you to quickly study, quickly get the same papers to study as RM. So Dr. Choma can also give us her experience when she started as a certified nursing assistant and where she is today in Germany. Do you understand? So Choma, you can also emphasize more on difference between a caregiver and a satisfied nursing assistant. Hello.
Hello. So
Yeah.
Yeah, so the difference between a caregiver and nursing assistant, there is really not much difference. But the thing with caregiving is you're basically specializing on taking care of old people. Yeah, like here in Germany, they have old people's home where you just basically focus on the care of old people, people who don't have families to look after them and all that. Then the nursing assistant, most of the time, nursing assistants they work, in the hospital. They assist and help nurses and doctors in the hospital, with like checking vital signs, checking the vital signs, and also, giving infusion, you know, cleaning the patients, you
treating
know,
patients, giving
feeding the
instructions.
patients and all that. Just those basic help that a
Well,
patient requires. So yes, and just
which is
like what
I cannot.
Organil explained earlier, that you work with a registered nurse and you also work with the doctor. So as a nursing assistant, you're there to assist them and help them with basic things, because in the hospital it gets very very busy, and that's where you as a nursing assistant come in, to help and reduce the workload, for the nurses, because as a registered nurse, like you're not just administering drugs for the patients and looking after the patient. You're also like documenting, making reports, bringing in new patients, and all that. So with a nursing assistant, they're able to like help reduce the workload. So yes. So I don't know if I answered the question. Um
You've done well. You've done well, Dr. Chama. You've done well. Thank you very much. Thank you. God bless you. Is there any more question for us to call it a day? We have 10 minutes
Yes.
for more questions.
Yes,
Mrs.
yes, yes.
Ake, Madam Tukas.
Hello.
Okay, we're here. We're listening.
Hello. Hello. Good,
Yes.
Yeah, we're
good
here,
Yes,
Madam.
we
evening.
still
Good
have
evening.
questions. We have the next person
Oh,
on
okay. Okay.
yes. The next person for question is Ido Olua. Sorry, I can't get the name all. Ido.
I think we'll stop
I
at
believe
Mr. Tosin.
Tosin,
Hello,
your
ma.
question answered, right?
This is Doula from Lion.
All right, ma'am. Sorry, let me ask Tosin.
Yes,
Your
ma'am.
question, I hope we answered your question.
Yes, you have. Yes, you have. The reason why I asked was because I was confused. People were like, caregiving is much more recognized abroad, and we don't have CNA training in Nigeria. So that's why I was trying to get a
Do
better
we have,
clarification.
we have.
What do we
Thank
not
God for
have?
you.
We have a professional one.
Have, oh.
We
We
have.
have
You
with the
just find
center
them.
with a very well
Okay, we
recognized
just
certificate.
Mrs. Dorcas, we tell you all about it. You just find them. One of the best in Abuja.
Oh,
Yes, all right. So
thank you.
let's hear from Idowu. Please ask your question.
All right, ma. I have two questions, but the first one says, any difference between nursing assistant and health assistant? Like nursing assistant and health assistant, like is there any difference between them? And then those that want to work abroad as a healthcare provider, so how do we go about it? Like we that want to work abroad as a healthcare provider, how do we go about it? Like the procedure and the steps to take.
Okay, are you already a healthcare person? Let's say, are you a doctor, a nurse, or none of the above?
I'm a health practitioner.
Okay, all right. So let's
You said your health
Ma.
assistant.
Yes, ma'am, health assistant, ma'am.
Where?
College of Health.
Okay. So what are the
So
duties
and
you
I
do?
work in a hello, ma'am.
What's your areas of specialization? So they no, their own is duties. They don't have areas of specialization. No. We are listening to you, sweetheart.
Hello, ma'am.
Yeah, we are with you.
What are
So,
your
Okay,
roles?
I mean,
The role
okay,
work.
sorry,
So
the
that to
network is
out.
not,
Like
can
mostly
you repeat your question again, please?
what
The network is fluctuating.
yeah.
do this withdrawal, and then we set um,
Okay, I think, sorry, Idowu, can you probably let the next person ask, then you come up again? It seems we can't get you clearly. Probably your network will be a bit stable
give do
then.
take
Please, let's have Chinonye ask her question. So after that, we'll go back to Idowu again. I think they are the last two people remaining, if I'm not mistaken. Okay, we still have a lot. All right. Chinonye, please
I
ask
can't
your
hear you
question.
again.
Good evening.
Good evening.
Yeah, please, my name is Liza Chineye. Firstly, I wanted to know if there's other means that we can meet apart from this side, because I could barely hear all our conversations. I could barely hear them. And secondly, I want to ask, as regards the certificates, is it possible for one that just has um auxiliary certificate to go, and what is the requirement for further ones that one could attain for to qualify for? And I don't know if you get what I'm trying to say.
Yes, yes, yes. I think I'm getting you.
Okay, I'm an environmental health student, but I did my nursing training, so I want to know what that are further, because I could barely hear the conversations that we were having. It wasn't really clear. So just for me to know what are the necessary steps. Sorry that I'm trying to get you back again. But like my first question, is there any other means that we can try to meet so that the network will be better than this site? Or if no, then what are the requirements for the other steps that one can take?
Okay,
Hello.
let me say that for the part you did not hear very well, we're going
Hello, can we
to
hear us now?
yes, ma'am. So we are going to
Okay.
drop the recording of this class. So for those that missed or couldn't get anything very well, so when we drop the recording, you'll be able to listen to it again. So I will let my Esther to continue with the remaining question answers, please. Hello, ma'am.
I don't with the questions. So you see, I shop that just turn off from my laptop, and I'm using my iPhone now. I think I can manage the network with it.
No problem. There's a record. We are recording the session. So after the session, we will drop the recordings so that
Okay.
you can go over it again.
Okay,
Sorry for
fine.
the network. It's just like that. We're struggling with it too. That's network for you in Nigeria.
Yeah.
So your
Networks.
remaining question, so I will let Madam Esther to answer that on the requirements and all that.
Hello.
Yes, ma'am.
Okay.
Okay, said requirement on what? The question was on the requirements.
Yes, on the requirement of
Hello.
for a wait, hello, the requirement for just an
Hello.
health assistant. Like I got an auxiliary nursing certificate. Hello,
Okay. You said you have an
I've,
auxiliary nursing
I've gotten
certificate.
an auxiliary nursing certificate. Yes, I have
Okay, you're
that.
having. That is what you have.
I have that already. I have that already, but I'm a
Okay,
BSc
fine.
student of environmental health.
Okay. Okay. It's on a good page. You're on a good page. So all you just need to do, even like I said, even an RM nurse comes to take this our training, and because the curriculums are different. So you have your auxiliary nursing certificate, You have the environmental
Yes.
health certificate, even the public health certificate. You're also adding a certified nursing assistant certificate because it's a certification for outside the country, especially when you're traveling outside the country. We are the one trying to spread it around now in Nigeria. Do you get it? On a professional level. So you
Okay.
have advantage to have all the certificates attached together. So now let's assume now you're
Okay.
paying salary in the facility for satisfied nursing assistants, you're paying them 2 million on a monthly basis. And they find out you have an auxiliary training too in a working system in a facility. Then at the same time, you have a public health BLC. That means they will pay you like
Yeah.
46 million naira. Did you see the advantage?
Yes, ma. All right. Thank you, ma.
So you're in
All
a good
right, you're welcome.
advantage.
So it's
Okay.
still what Madam Esther is saying is that you are still good to go to have a CNN certificate attached to that
Exactly.
your certificates.
Okay.
All right. So let's look
Okay.
at Ofem Doris, please. The next person is Ofem Doris. After that, we'll have Monica. Uh-huh.
You guys are
Okay, good
exceeding your
evening.
10 minutes.
Good evening.
Good evening. This is Ofem Doris, please.
All right.
Hello, this is Ofem Doris.
Yes, go ahead and ask your question, Doris.
Okay, my question is this. If you are not into nursing, but you are into medical lab science, does it have, what's the correlation? Can they work hand in hand? Can someone have this same certification alongside with working in the lab?
Okay. If I get your question correctly, you are working in the lab. Let's say you're a lab scientist, and then
Yeah,
is this still okay for you to get the CNA certificate? Is that what you mean? Or
yes.
do you? Or
Or
okay. So I think my answer would be yes, but I will still allow the professional to say something. Hello, ma'am. Hello.
hello, I'm listening.
Yeah. I'm referring to my Esther.
Okay, I can't hear her because she's saying something, but I can't hear her.
Hello.
Esther, you're muted. Unmute your mic.
Can you hear me?
Yes, we can hear you now.
I said it
We
adds
can
to
hear
your
you.
value. Every
All right, ma'am.
certificate you have additional with the certified nursing assistant, it adds to your value because you now have a training, a professional training on how to work outside the country. Do you get it? So it gives you a value. It gives you a good edge to work and make more money. If somebody who just had an auxiliary nurse certificate supposed to apply for this thing and you do not have a professional certified nursing certificate, they will use it for 2 years. But this is a training you're going to come to train with us for like between 3 to 4 months, and you grab that certificate. They will use it for, so imagine how many years of your life they're using. Then they will tell you to go and acquire that certificate. But that period you have for the 4 months you have spent with us here, do you get it? Then the 4 months you spend with us here, you just go there, and after 2 3 months you have worked, you can tell them every facility abroad has university. Every facility abroad has their university. Do you get it? So what do? You tell them, oh, with this satisfied nursing assistant certificate that I have, with my public health certificate as a lab scientist that I have, I want to study RN nurse. Within 3 4 years, you're done. You start earning an average of 10 to 15 million naira a month. That time, you're not going to remember me and Korode and Doris. That is the truth. I'm not going to
Wallahi.
I go remember you.
school fees. That training of 3 million, that they call that small price for now.
Okay. Thank you very much, ma'am. Monica, please, can you ask your question? Please, let's
Okay.
make it as we still have a lot of people on the list so that we could at least be able to attend to many people.
Okay. Good evening, everyone.
Good evening.
Okay, good evening. I'm giving another 15 minutes for questions because I have patients
Okay,
in my facility
okay,
and my
ma.
father is there too.
I joined the group lately, but from where I joined it, the conversation I'm having, and I got from others, because my first question is, okay, how can we add this certificate to our CVs? And the second question is, okay, because I am a practitioner, I'm a community health practitioner, and I'm a BSc in public health graduate. I have BSc in public
And
health,
take this
and I have.
certificate and join and go and pack money and give us our percentage.
Okay,
Your
ma, how
question
will
has
I
been
get
answered.
there? Mommy, how will I get there? Ma, you made me the
Come
reason
and
why
join
I
us.
see.
Come and join our training.
Okay, I'm in Abuja right now. I heard you saying like you have a training somewhere in Abuja or something.
Yes,
If you're in
we have a
If you're
center
in
in
Abuja,
Gwarimpa.
come and join us. Come here
Okay, in
on
Gwarimpa,
So,
Tuesday.
please put
Mr.
on
yes,
K,
the
so I will
address.
take
put you.
him to Guarimpa.
Don't
Yes, I
worry,
mean.
that I will
Madam
put you through
Dorcas,
in the
Mr.
group,
K.
please.
Okay.
Madam
We would love
Dorcas,
to do
Mr.
that.
K.
I will bring that up in the group so that those that want to take the training of a certified nursing assistant will put you through and then link you up to the center here in Abuja.
Okay,
The
okay,
center
that
is
one.
in Gwarimpa
So
here.
meet with
Yeah,
Madam
so we can
Dorcas
Okay.
put
and
that.
Mr. K. They will put you.
That's it's very close to me. And the second thing is, if we do now, do you people have a means that you can help us to put us through, as in to hold our hands to reach where we're supposed to reach, like in the abroad or other for other countries to work?
Yes,
Is
ma'am.
there any like
People
help
have
for us?
what?
I
If we
say, is
can
there any
assist
help
you in
after the
getting the job
training?
abroad, right?
Yeah, to help us get the job abroad.
If we're going to support you to get job abroad,
Yes, ma'am.
the only country I can assure to give you job abroad now is in
Yes.
Germany, which you can interact with Dr.
Choma.
Chioma. Chioma, that is your question. You tell them the procedures on what to do, what the cause is, and all that. Let her do. You communicate with her. She connects you
But
to the
that
agent
technique,
who
they
will
told
do the
you
procedure and everything. And that is
you
in
have to
Europe.
learn their
Anywhere
language.
in
You have
Europe.
to learn.
Anywhere in
Is
Europe.
there any
We'll
English
do that for
country that
you.
it will be
We
easy for
also
us?
have Mr. K too can open also. He said what?
I said that Germany, we want a country that is we can speak English that will not hurt us. Since we are going there, we don't want. You understand?
Everywhere in Europe,
You
anywhere
will
around
learn.
Europe, that is
You
where
will
I can
learn.
assure you 100% for now. Anywhere in
Okay.
Europe. So, like some of the students who are here with us, some of the student nurses who are here with us, some of them have started while they are doing training. They have started this in French school because you can work in Luxembourg if you are speaking French. They speak French, they speak English. Then other also group too. Then German language. Some people too. They've also registered with German language too while they are doing the training, so that they can
Thank-
be able to get a job in Germany or anywhere in Europe.
Okay. Oh. That's it. Since you can help us, thank you for that. So we have time and we'll get contacts now. At least if there's anything we hear from you people
So
and you help us. Thank
No
you.
discuss in
problem.
details
No
with
problem.
Mr. Korode and Madam Dorcas. They will connect you
Okay.
Okay.
to Dr. Thelma in Germany, so they will start the processing for you, tell you what to do and all that.
Ma, what of all this US, UK, Canada?
For now, we are working on something with Canada to partner with them. So we don't want to talk in detail. See, when we seal the contract, Mr. K can tell you that we've written to the people, the school who actually wrote us for us to partner with them to be training their students while we do other things together. So Mr. K will tell you that in details after now.
It's all right, ma.
You're
Thank
welcome.
you.
All right.
Mr. K, take note of that, please.
Sure,
No problem,
definitely.
madam.
Okay. So any
Are they
more one question?
take
More one
where?
question. So I will call it a day.
Ma, can we just
Hello,
allow all of them run out their questions?
I have a patient
hello,
here, and I told K that I was gonna do 1 hour for today.
Okay,
hello,
so
All
probably
right.
we'll move the
And I'm
remaining
exceeding more
questions,
than 1 hour
right?
now. I'm sitting 1 hour, 30
Sorry,
minutes
ma.
now.
hello.
Sorry,
I'm
ma'am.
not going
So
to
let's
waste
have
your
the last
time.
person ask the question. The other
So,
one,
but
please, you write
if they
down your
can send
questions
us the
and drop them
question,
in the
if they
group.
can send us the question as a write-up,
Hello,
then we'll
I'm
reply
not
them on the
going to waste
platform.
your time.
All right.
I'm not going to waste your time. Good evening, everyone.
Good evening,
All right.
ma'am.
Go ahead.
My name is Adefe Egbe. I'm a registered nurse.
Okay,
a
ma'am.
registered midwife, PNSC nursing.
I
Please, I
greet you,
want to
mommy.
thank you, ma. I
You're
want to
welcome,
ask,
ma'am.
as far as this certified nursing assistant certificate training is concerned, do I still need to undergo this training in order to pursue my career in abroad?
Yes,
That is
mommy.
number
Mommy, I'm
one.
also a registered nurse. Studied when I got to abroad.
Used to.
I have to go and do satisfying nursing assistant so that I will have at least a paper. I have a paper that is attached to their certificates. Do you get it?
Okay.
Yeah. So
Uh,
what you
but
because they are curriculum, because as a Nigerian, they will not even allow you to start administration immediately. They will
hmm,
be watching you. Do you get it? So you just
okay.
like you just attach it to your certificate, an advantage to it. So when they say go and do this thing, you tell them you have it already. When they say go and do the advance, you are going to someone like you. We're also introduce it. Sake, please take note of mommy. So she will do the
All right.
ACL international certificate that will help to boost more of that Nigerian certificate of RM.
All
All
right,
right,
ma'am.
ma.
Yeah,
Okay.
I think that is one major thing she also need. Then the training. So please, Madam Dorcas
Okay.
and Mr. K, put notes at that. We'll just do that for mommy. Mommy is almost there. Mommy, do that for you. Because I know that as soon as you get there, your salary will get up to 8 million naira. Be giving us 1
Amen.
million for 3 months. After we finish what we're doing for you. Just the three of us, give us 1 million for it. It's not bad. Then you
But
give the
but
remaining tithes to God.
for someone who cannot come over to Abuja for the training, can we
Mommy,
have an online training, ma?
mommy,
I
where are
don't know.
you? Mommy,
Uh,
where are you?
I'm in Ogun State.
Ogun State, you try, even if it's 2 week vacation in Abuja, you have to come. So
yeah.
you see the difference between professional, the people we train here, mommy, thank God you're an RM. So the people, there is things I do for mommies like you. When we're going to do medical outreach, I would like to invite you to come. You will see the satisfied nursing assistant we train here when we go out on a medical outreach. Or go to our website, you will see the jobs we do on medical outreach. If I tell you those nurses are satisfied nursing assistant trained by us, you will be shocked. Sometimes when we go, the RM nurses who has been practicing for 10 years, they look us like Suleiman because of the professionalism, because of the way they are working as professionals. So that is what you need now. What you need now, let me tell you what you need now. In as much as is a business, we need money. We're trying to be sincere so that the people, I want a time that when we're doing this thing, millions of people are gathered. Because you know, when you're doing something and people are seeing the fruit out of it, you see people will gather, the more you grow. We're not making noise. If you see us, we're quiet. We don't make noise on FB. You see us, we just do our little advert, and people will come all day. Their testimony is what we're living with. Their testimony is what is increasing this place for us. They will be the one bringing more people for us. So though we're going to do for you, we're going to make sure you acquire the international certificate of the health and safety, then international certificate of cardiovascular to attach to that your certificate. Then you spend 2 weeks at least with us in the facility here in Abuja, then the medical outreach. So you see what they do professionally. Then you're good to go anywhere you want to go, mom. People are
Thank
spending
you,
three
ma.
months, but because you're an RM already, you just need 2 weeks to come. Let us help you on a professional level. Then you're good to go, man.
Thank you, ma. What is the
Excuse
cost
me, ma'am.
implication?
Mr. K, please give him details.
We,
Madam
we,
Doctors, give her
Usman will
Ma,
details.
communicate that.
It's okay. All right. So I
ma,
think
how
we
long
need,
is the training in Abuja?
it's a 3 months
The
For
training
training.
is
for
for
the
3
doing the
months.
certified nursing
3 months
assistant, it's
in
going to
training,
take 3
please.
to 4
What
months.
the
It's going to
location?
take you 3 to 4 months.
All
Then,
this will
but
be
since you are
explained in
We
the
will
because
discuss
you
groups.
that
have
with you
RM
in the
now,
group.
because you have RM, we are going to do this thing. When you're ready, you pay the money to the people outside the country. What we need to do within 2 days, 3 days, they send your certificate you need from the one outside the country to attach to your discount. But you must spend 2 weeks with us in the facility.
All right.
Please,
Okay.
how long is the training, ma?
The training is a
Are
three
you
months
good,
training.
mommy?
Sir?
Sorry, I'm not being partial because an elderly woman that is talking and she's a colleague. I have to respect her and give her all she needs. Okay, I'm
All
not being
right.
partial.
Please, okay.
So can you
So
answer my question now?
to the
Okay,
last
the last
question,
the last
it's
question.
officially 3 months. It's a 3 months
Okay.
training. Yes.
Okay, 3 month
Officially,
training.
then
Okay.
internship and all that extra 1 month.
Yes.
Okay. Can the fee be discussed later, or we're going to tell us?
Later,
It will be
because I'm running
The
discussed
out
in the
now.
various groups.
location too,
So
because I'm also in
That will
don't
be
worry, we
Abuja
will
too.
discussed.
handle that. She's rushing to attend to a
Madam
patient,
Dorcas
please.
and
So
Mr. K,
we will discuss that with
please
you, ma.
handle that.
Okay, okay,
Okay.
Can I
thank
go
you.
now? Can I go now?
Yes, ma.
Can
Yes,
I
Yes,
go
ma.
ma. We
now?
Thank you so
release you.
very
Can I
You
much.
go
can
We
now?
you
appreciate
can't
you.
go. We still want to see your
Can I
face.
go now? Oh my God.
Thank you so much. God
Can
bless
I go?
you.
You're welcome. You're welcome. This is
Thank
my
you.
face. We're having challenges with. Okay, this is my face. Can you guys all see my face now? This is my face.
You look good.
Thank you, mom. Thank you. God bless you.
Thank
Thank
All
Thank you
right.
you.
so much,
I'm
Thank,
you
Ma.
so
thank you
running
so
much.
much.
Thank you
in.
so much.
Someone made
Sure.
my day. Thank you.
See you
God
tomorrow.
bless you
Thank
all.
you.
All
Thank you.
right,
While we
ma.
pursue, as we pursue
Bye
this goal
bye.
of healthcare to spread worldwide, spread in Nigeria
Uh,
on a
Do
professional
we
level
still
on
have tomorrow?
healthcare.
Do we still have the same time
Yeah, we do
tomorrow?
have tomorrow. May God Almighty give
Okay,
us
ma.
the
Yeah.
strength and
Yes.
enablement. Thank you very much.
Amen.
God bless you
Amen.
all.
Thank you very much, ma. God bless you.
Thank
Yes.
you.
Thank
Bye.
you.
Thank
Thank
you.
you, Ma.
Bye-bye. Bye.
Please, Mr. K. Okay, before Mr.
All right.
Korede will talk now, before Mr. Korede talk, please, those of you that your hands are still up, we apologize. We have Benedicta, we have Florence, we have Queen, and then I think there's somebody else, I think Idou. You can still write your question and drop it. We'll send you responses, and then we'll still have time tomorrow. So I will let Mr. Korede to round up the session and then be able to give us a little information on the CNA course and the remaining aspects before we call it a day. Thank you. Mr.
Ma,
Korede, please.
what about today? So for those of us that had a problem with network, how can we listen to it?
Yeah, we will share the recordings. I will drop the link in the group so that we'll all
Okay,
click and then to it again. Yes, ma'am.
okay, thank you very much. Thank you very much.
Welcome.
All right.
Yeah.
Thank you once again, everyone. You are all highly appreciated for taking out the time to be part of this program. I want to believe that you have gained something from the introduction to the CNA, to what it entails, to what you should expect, to what is required of you, and what sort of opportunities that there are out there. All right, so thank you so very much. This class continues tomorrow by 7 p.m. as well, and hopefully tomorrow we actually have two speakers. So Mrs. Esther will speak to us, but we also have someone else who is a travel agent who can probably go into the technical details of what is needed to actually travel to the country of your choice. So whether it's US, is UK, or Canada, or European countries, these are the questions that hopefully will be answered tomorrow. Concerning the program in Abuja here. That's the Certified Nursing Assistant Program. Just as she has said, we are based in Guarimpa and it's a 3 to 4 month program. It is 100% practical and we focus and we stress the practicality of the training. That's why it's difficult for us to respond to those who want an online training. We make exceptions for the online training, but you still need to come around for at least 2 weeks to be able to finalize your training. So the details concerning the fees will all be answered within the respective groups because I know you're all from different training providers who have invited you to be part of this program. So you can go back to your respective groups. For those of you that are in Abuja here, it will be easy for you to come over to the center and make your inquiries. You can get to see her. She's around. She's in the country at the moment, so you will have that opportunity to meet her. And then for those of you who want to travel and come down for the training, we also have accommodation options, but there's a fee attached to that as well. But definitely you can come over if you want to spend the full 3 to 4 months. It's 3 months officially, but there's 1 month extra if you choose for you to gain more experience and be part of the medical outreaches that take place. All right, so that's just a brief summary of what we are offering as well. So once again, thank you so very much. We'll reconvene here tomorrow. For those of you who came in late, or due to network issues, you could not hear what was happening, a recording of this session will be provided for you, and definitely you can listen to it carefully. For those of you that also have questions, you can relay your questions or post your questions in your respective groups so that we can forward them to Mrs. Esther so that hopefully she will have more time to be able to answer the questions. And hopefully, the questions that are answered will be able to answer for those who also have similar questions as well. All right. So, once again, thank you so very much for being part of this program. And we look forward to seeing you tomorrow by the same time, 7 p.m. So, thank you so very
All right.
much.
Thank you. Thank you very much, Mr. Korede.
Thank you very much.
All right.
Everyone.
Thank you.
Yes, I
Night.
want to add a little. We'll be having somebody coming up as a travel agent, as in tell you the details and the technicality in traveling and all that. Please, we don't recommend you to transact any business with anyone without you hearing from us. You understand? Because I know people, when you hear travel agent, you're like, oh, I can help you process this, please. We will not be letting that to happen. The person is just coming in as a resource person for this. So don't talk with anybody. Let's say after the class, okay, I want to follow your organization, and from there you reach out to the person and then start doing any process of traveling. Please, we will not be recommending that. If you need any assistance, still reach back to the admins, to the group where you come from. We'll find a way of helping you out on it. I don't know if I'm clear on that, because
Okay.
we don't want
Yes.
somebody to
Go
say
ahead.
he's being
Yes.
scammed from our group, please. Yes, I know how people are these days. So let's just tread with caution. Allow us to lead. If you need any help, you feel like, okay, I want to process this, allow us to advise you properly and link you with the right people for that. All
Okay.
right. So thank you very much, everyone. So we will get in touch. Somebody was talking about the issue of the traveling. I think we'll get in touch with Dr. Choma, and then tomorrow we will round up everything. I believe by tomorrow we should be able to get satisfied with everything and all the questions that are still lingering in our minds. Thank you, everyone, and good night.
Night.
Good night.
Good night. Good night.